All right. Everybody, welcome back to the final session. Thank you for sticking with us. Have you been having a good time? All right. I have been to some amazing workshops and I think I've missed some amazing workshops. So really glad thanks to all the speakers who have been here. So this final session, we're going to talk about the road ahead and particularly what the Tennessee Healthcare Campaign is planning for the next year. We were founded in 1989 as a statewide organization, and that's still our structure, volunteer-led. Give a shout out to Tony Garr here, who was our founding father. Our mission is to advocate for policies and programs that improve the health and well-being of Tennesseans. And we're going to talk about several of those programs right now. We are a nonprofit insurance agency. We started that in 2021, was our first full year doing that. And we help people enroll in TennCare and healthcare.gov. And Sylvia and Meryl are going to talk about that work. We continue to do advocacy as we have done all along. We're going to talk about what that work is looking like right now. In 2021, we started, well, 2021, we started a vaccine equity project to promote COVID vaccine in communities of color in rural Tennessee. And we're really excited about that work. Juana's going to be talking about that. And we've been doing rural hospital research. Some of you, I know, were in the last session that was talking about the rural healthcare crisis, but Tennessee leads the nation in hospital closures. And so we've been trying to look at why that is and how we could change it, what works for hospitals. So we'll be finishing up with that. And then at the end of the hour, our board president, Rich Hennigan, is going to give a final thank you. And we'll give out some amazing door prizes, including those flowers. So stick around until the bitter end. Don't you have the next one?
Sylvia does.
Yeah. Okay, I want to introduce our brand new Director of Enrollment Services, Sylvia Casadilla.
Oh, I'm there. Good afternoon. Thank you so much for being here in this beautiful Saturday, because it's beautiful out there. Like Judy said, my name is Sylvia, and I'm very excited to be the new Director of Enrollment for services for THCC. At THCC, we help people with, one of the programs is we help people with TennCare covered kids in the marketplace. We assist them with their applications and the whole process. I'm going to tell you briefly about TennCare covered kids in the marketplace. TennCare and covered kids are healthcare for low-income people who meet the federal income guidelines and are Tennessee residents. People can enroll any time of the year in TennCare and covered kids. Who qualify for TennCare? Children under 18, 19 is still in high school, parents or guardian of a minor child, people with a disability, US citizen or qualified non-citizen. For example, someone who had their green card for the past 5 years can qualify. And TennCare can be used as a second healthcare plan. So they'll work with another insurance. Covered kids, who qualify for covered kids? Children up to 19, if they turn 19, if they do the application before the day they turn 19. People that don't qualify for TennCare qualify for covered kids. A lot of children that don't qualify for TennCare will qualify for covered kids. And US citizen qualify non-citizens, like immigrant pregnant women, who qualify for covered care without having to submit any proof of immigration status. A lot of people don't know that. Pregnant women who health plan does not cover maternity cannot qualify for covered care too. Now, the thing about covered care is that covered care cannot be used with another plan. It has to be alone. And now the marketplace, open enrollment, like they said, it's gonna be November 1st to January 15th. And who qualify? People who live in the United States, US citizen, and people eligible with eligible immigration status, like people with employment authorization or a green card. When they have Social Security, pretty much they qualify. And also, people cannot be incarcerated to qualify. And pretty much that's a brief description of the 3 programs. If you need more information, if you need help with any of these programs and any of the services, please contact THCC. We'll be happy to help you. Thank you. And now we have for Meryl.
Okay. I see nobody put a Coke box up here for me to stand on, but I'll be okay. I'm Meryl Rice, and I've been enrolling people in the marketplace insurance since its initial rollout in 2013. Initially, I was a volunteer and then a navigator, and now I'm an insurance agent. Over the years, I've enrolled hundreds of people in the marketplace insurance, probably even a couple of thousand. I'm very proud of my work, especially with the Muslim community in West Tennessee. I've made a lot of good friends. I've gained their trust, and they've allowed me to set up enrollment venues in their mosque. And they've referred a lot of friends and family to me. And every year they invite me and my husband to their Ramadan feast. However, the experience that's made my work the most gratifying has not been that experience with the Muslim community, although that was gratifying, but it was my work with a family, a rural couple from West Tennessee, from McNairy County, as a matter of fact. They were referred to me by a friend who had made some terribly disparaging remarks about that dread Obamacare. However, in this case, this couple that he referred to me were at the end of their rope, so to speak. And he sent them to me as a last resort. See what you can do to help them, he said. So the husband had VA insurance, but his wife was not eligible. She had no insurance at all. And she was too young for Medicare, too poor to buy private insurance. But she was very ill. She was a severe diabetic with heart problems. And when I first contacted them, she had just returned home from the hospital in Jackson, having had several toes amputated. She was very, very weak. Her husband literally had to carry her from one side of the room to the other. And she could hardly speak above a whisper. Well, because she had no insurance, the doctors had just basically put a Band-Aid fix on her problems, and she wasn't getting the help that she needed. The couple had exhausted their meager savings paying for what little health care she did get. So that year we enrolled her in a United Healthcare plan for $15 a month. That was the least expensive plan that was available in that area that year. Well, as soon as their insurance became effective, they made an appointment for Vanderbilt. And later, she told me that that first trip to Nashville was a terribly hard experience on her physically. In fact, halfway up there, she told her husband to stop the car, that she didn't think she was going to make it. She thought she was going to die before she got there. But she didn't die, and he got her there to the hospital, to the doctor's office. And the doctor started her history and physical, but he didn't finish it. He said to her, I don't need to finish this. I need to put you in the hospital now. And you need to have surgery. You need to have open heart surgery. So that's what she did. She had the surgery and it changed her life. The next year, when open enrollment rolled around, I met them at the public library. She didn't even look like the same person. She was walking and talking. And if I had not known that she had been a sickly person, I would not have thought that was the same person at all. She didn't appear to have any problems. And she was the one that engaged with me that year and did the application. The previous year, her husband had done all the talking. But she engaged with me that year and we looked at options for insurance plans. And as we were discussing those, she said to me, my friends, they all ask me if I have Obamacare. Is this Obamacare? Before I could answer her, though, her husband chimed in. Look, lady, I don't care if they call it donkey care. All I know is that it saved my wife's life. I believe that I probably enrolled her 3 years in a row before she became eligible for Medicare. And then about 3 years later, my husband and I were sitting at a restaurant in Jackson having dinner, and a man came up to the table with tears in his eyes. And he said, "You're Ms. Rice, aren't you?" I answered, "Yes." He said, "You saved my wife's life, and I'll never forget it. I just wanted to come by and thank you again." She's sitting right over there. So I looked over there. She looked back and she smiled and waved. That's why I do this work.
Sylvia's video. Go back to it. And now I believe Juana is next.
Yeah, we got a video to show.
Oh, okay, sorry.
My name is Sylvia Calzadilla. I work for Tennessee Healthcare Campaign, and my position is Director of Enrollment Services. Okay, I'm going to talk about the immigrant community. I work with the immigrant community for many years. And one of the things that I noticed is that a lot of people believe that because they're immigrant, they don't qualify for healthcare. A lot of times that is not true. They make decisions based on information given to them by the person that didn't have the right information. So they dismiss the opportunity of getting healthcare before knowing if they qualify for it or not. Many people, like people that has employment authorization or they have a green card for 5 years, they qualify for teen care sometimes, and they qualify for the marketplace, but they don't know about this. So I always tell people, before you dismiss the opportunity of getting healthcare, get the right information, get informed, and then make a decision if you qualify or don't qualify. In Tennessee Healthcare Campaign, we're ready to help you anytime. We can answer questions and we can help you do the whole application, the enrollment. You can call the number 844-644-5443, and we will help you with whatever you need.
Farm game break coming up next, following Falcons and the Saints. Jameis Winston hoping to.
It's a great
I'm so
intro.
sorry.
We didn't want to know the score.
That was a great intermission. Good afternoon, everyone. I'm Juana Hodge. I am the Vaccine Equity Program Manager. And I just want to, this way? Yes, that's good. I just want to share a few facts with you about our program. I want to talk about the purpose, the goals, and how we're becoming successful with this project. According to the Center of Disease Control and Prevention's Vulnerability Index, there are 6 counties in West Tennessee that are high on this index. Our goal here is to simply increase the number of vaccines, COVID-19 vaccines that are taken in these counties. These 6 counties are Lake, Lauderdale, Hardeman, Haywood, Crockett, and Madison County. These are our target counties. These are the counties that we will serve. The quality, the vaccine equity quality, calm down. The vaccine equity program's goal is simple. We want to pinpoint what those barriers are and understand the hesitation of the residents that are in our communities. We want to culturally create information that can be used to promote the vaccine program. We also want to identify and collaborate with key leaders and promote the program. Most of all, we want to monitor our goals and track our achievements. So we are going to continue to do those things. Our success is based on strengthening our relationships with the people in our community. We are currently building relationships with religious organizations and their congregations. We work with local organizations such as the NAACP in Hardeman County, and we work with that organization in Haywood County. We have participated in 3 back-to-school activities, 2 in Hardeman County, 1 in Haywood County, and the Hardeman County Community Health Center. We're working with sororities, fraternities. Alpha Kappa Alpha Sorority Incorporated is one of our partners, and Alpha Phi Alpha Fraternity is one of our programs. We are willing and open to work with any organization, Greek or non-Greek, to partner with us or to volunteer. We also really depend on our trusted community leaders and their residents that are in those counties. Our vaccine ambassadors are really key to what it is that we're doing, because they are key people already trusted in the community. They've worked with Tennessee Healthcare to promote video, printed, and audio material to assist with advertising and promoting vaccine equity in our counties. So as a treat that we have this evening, please listen to Javante Mahone. He is one of our ambassadors. And what he's going to share with us is exactly why the vaccine equity program is important.
Hello, everyone. I'm Javante Mahone, the Tennessee State Youth and College Division President here in the state of Tennessee. I also am a proud brother of Alpha Phi Alpha Fraternity Incorporated. January 15th this year, I lost my mom due to COVID-19 complications. It was then I knew, that I needed to take measures to protect the ones that I love, the ones that I hold dear to me. So that was my main motivation for getting vaccinated, and it was really helpful. After it was approved by the FDA, emergency approved, I knew that it was good enough. So I just went on. I didn't hesitate. I did look at the facts. I did do some research towards it, but still with no hesitation. When they announced that I was able to get the vaccination, I didn't waste any time. No major side effects. I did have some chills, but that only lasted like a couple of hours. And after that, I was really good. I would like to say, though, the nurses that gave the vaccine to me, they encouraged me. They told me exactly what I needed. I got what I needed. And when I felt like the side effects were coming, I took what I needed, and it was taken care of right then and there. Learning as I knew it, learning on a college campus as I knew it was not the same. The transition was difficult. I had never really taken online courses, and I do much better in person with my professors. And I only say that because you do want people to enjoy the freedom of choice. However, like I said earlier, being indebted in this work, contributing to the lives of people that you are so sold out to saving lives, helping people. It then turns, at this point, after my mother's death, I say I can't have too much empathy toward those who do not want to get vaccinated, because it took my mother hearing of a vaccination to give her some hope, but it took a person who was unwilling to get vaccinated that gave her COVID-19 that caused her ultimately, to be in the predicament in which she was in, and then also led to her death. Empathy, yes, I have to a certain extent, but when we see the statistics, the facts of it all, how effective these vaccines are, I think at this point, this rate, we're not trying to lose lives. Let's save as many as we can.
The one last thing that I would like to share with you this evening is that if we protect ourselves by taking the vaccine, we will also protect our family, members in our community, and we all will be safer in the process. So next we have Mr. Tom Savage that is coming to share with you.
Thank you, Juana. Am I looking good? Am I straight? Okay. This is as good as I can do, Rich. Thank you for the opportunity to speak to everyone and to our emeritus president, Tony, and our current president, our director, and the board members, and all of you who are valiants for affordable health care. It's great to have a conversation with you and to all of my colleagues here. They say if you don't know where you're going, that you can take any highway. But we know where we're going on this road to affordable health care for everybody, for all. Everybody say for all. All right, then. But anyway, again, my name is Tom Savage. I am the Health Outreach and Volunteer Coordinator for the Tennessee Healthcare Campaign. It is my job to connect at the hip with those who advocate for what we do. And some of the conversations that you've heard thus far, we reach out to anybody and everybody who would be an advocate for the least of these. We cover all 3 grand divisions of the state of Tennessee. We have friends in NAACP, labor, any organization that you can think of that lifts up another brother or a sister. And this movement is actually a movement. And the last great movement that we had was the 1964 Civil Rights Movement, which brought us the Civil Rights Act. And everybody in play, it was good organizations like Tennessee Healthcare Campaign, religious groups, and groups like the NAACP. That's what brought that about. And I think that should be the attitude that we have for healthcare for Tennesseans. So as an outreach coordinator, we address healthcare. My area that I concentrate on, I help everybody, but the Upper Cumberland area that I live in, Middle Tennessee, Judy is associated with East Tennessee, and I'm there to help. And then I connect with Juana as she goes to West Tennessee. We reach out to, in regards to paternal health and mental health, which is kind of new in the BIPOC community, Black, Indigenous people of color. There's a stigma in the Black community, and it's in a race-conscious society, some don't want to be perceived as having another deficit. And I like what Naomi Osaki said, that it's okay not to be okay, and it's okay to talk about not being okay. And that's really what we're working on in the Black community, because we've kind of hid those things in the closet, and it's time to come out and to address that so that we can have a better day. I'm looking at this picture here, as my sister here presented it to us as we were putting this together. You can see that It looks like her eye, there's like a tear forming in her eye. And it's and to me, as I connect that with healthcare, it's kind of sad because we know people are hurting, but it's our goal to turn that into tears of joy. And that's a good thing. Next, please. And so I always say this lady looks like Maya Angelou. Does she kind of look like her to you? She is not alone. We mentioned people who are doing well with healthcare, but there's so many Tennesseans who are suffering. And she is not alone. Approximately 300,000 Tennesseans who work every day, and as I say, have skin in the game, are wanting affordable health care. And it's our job to present stories with legislators. We do lobby, even though we're nonpartisan, but we go in there and we try to move the hearts of legislators and to where they can feel what we're talking about, to feel the need that people need healthcare in the state of Tennessee. And that's Judy and I's goal, to move those legislators on behalf of the Tennessee Healthcare Campaign. Merle gave you good feeling stories. It's our job to give those stories that will shake them up. And that's what we're trying to do. So this lady is not alone. And I want to share one story with you. And this is called Vanetta's story. And hopefully that you'll see what we're trying to do. And we want to present this as we go out into the field. Everyone, Vanetta's story.
My name is Tom Savage, and I work for the Tennessee Healthcare Campaign. And my story is Vanetta's story. Vanetta is one of many Tennesseans who work every day uninsured. Although her income is under the federal poverty level, she is ineligible for TennCare under Tennessee's restrictive eligibility rules. In the month of October, Vanetta decided to go on a very well-deserved girls' trip to the Florida beach. While walking on the hot, sandy beach, Vanetta suffered severe blisters on her feet due to her diabetes and neuropathy. Vanetta tried to get help for her feet by going to the health department and emergency room. The health department was able to design a walking boot for Vanetta that would allow her to work on her job and maintain her income. However, while departing the health department, Vanetta tripped over her boot and fell and broke her fibula. She was admitted in the hospital and stayed for over a week. While hospitalized, she was giving therapy for her blistered feet. Diabetes complicates her wound healing, and she still needs outpatient therapy from a wound care clinic for a slow healing feet. The hospital discharged Vanetta with a $6,000 hospital bill and no means to get continued outpatient therapy. She's not able to work. Vanetta had to move out of her apartment because she has no income and is unable to climb the steps to her apartment. Vanetta suffers from the thought that she is a burden to her family and friends. The Tennessee Healthcare Campaign will continue to speak for those who work every day to add the dignity in their job with affordable health care. Tennessee, we are better than this.
Thank you, everyone. The guy that was with Vanetta is our ambassador. He's a pastor in the Middle Tennessee area. Turn it over to our director.
Yeah. So I'm going to talk about the final program that we're going to highlight today. This is about rural hospitals. My name is Judy Reutman. I'm the Executive Director of the Tennessee Healthcare Campaign. Our mission is equitable, affordable access to quality healthcare for all Tennesseans. About 5 years ago, we got very concerned about the number of rural hospitals that were closing. Tennessee leads the nation in rural hospital closures per capita. We teamed up with Vanderbilt University to research the problem, and we went out and talked to people in the rural communities. The closure of the hospital was very difficult for rural communities. In a lot of places, the hospital was the largest employer, and it was hard to replace those jobs without a hospital to recruit new industry. It was even hard to recruit new residents. it was particularly frustrating for communities along the border of Arkansas and Kentucky because they saw that rural hospitals in those areas were not having the same level of problems. And the reason for that is that those states have expanded Medicaid. So Tennessee hospitals are drowning under uncompensated care. It doesn't have to be this way. And Tennessee can do better. We can expand Medicaid and we can take care of our rural residents and protect our rural hospitals. We started doing rural hospital research, 3 years ago, 4 years ago, when we realized that Tennessee was leading the nation in hospital closures. And we did a participatory research project with Vanderbilt University to try to interview people in those communities and find out what was going on. A recurring theme in those conversations was the ambulance is our emergency room. The closure of the hospital was putting a real big strain on the EMS services. They were having to carry people for, an hour instead of 15 minutes. And when you've got somebody in the back of your ambulance for an hour, you have to be able to actually offer them something more than a ride. You got to be able to deal with whatever their crisis is. If you've got one ambulance going for an hour to Vanderbilt and somebody else gets sick in your community, then what are you going to do? So you have another hospital, another ambulance. All those issues were really expensive for local communities. We also heard that the healthcare providers lose key supports. They don't have any local place to send people for their lab work or their x-rays or to get a specialist opinion. And the local economy slows down as a result of the hospital closures. So the report that we came out with offers advice for rural communities that are facing closures. And we got some here if you want to pick one up on the way out. The report recommends some policy, particularly, obviously, THCC expansion. But we also recommended statewide oversight of hospital purchases. We've had some very bad actors buying up hospitals in Tennessee and running them into the ground and selling their equipment and, just really not being interested in healthcare in the community. We encouraged hospitals to offer services that the local community needs, and in particular, to increase addiction rehab services. And we also encouraged transparency, that hospitals be more open with the local community about their struggle and to see if the local community can step forward and do something to help if they're warned. In the past, they've just, been told it's a done deal and there wasn't anything that could be done to stop it. Our rural hospital research team has taken on the next project, which is to look at those hospitals that are not closing and find out what their magic success is. And we've just started that research. We've been doing some key informant interviews in a number of rural counties. And so stay tuned for that report. I want to encourage everyone who's been at this conference today. You've heard a lot about what needs to change in policy in Tennessee, and I want to encourage you to take action. Send an email to Governor Lee. Visit our website. It's real easy to send an email from there. You can just click and it'll put your name in. As I said, you're welcome to pick up a copy of the report on the way out. We'd love to have you volunteer with any of our programs. So if you're interested in volunteering, there's the volunteer coordinator. I think somewhere around here, we've got a volunteer sign-up sheet. I'll try to track that down before we end here. We are always looking for stories. And those of you who were in the workshop with Abby from North Carolina, she pointed out it's not easy to find people who want to talk about their lack of health insurance, but those stories are so important to putting a face on the problem that we're dealing with. And we're also looking for vaccine stories, people who have decided they do want to vaccinate their kids and tell us why, and be examples for the community. We're looking for stories. We always need 5 times as much help on our advocacy work as we have. And if you're interested in conferences, we need help on the conference committee too. So I will throw it open for questions. Some of you who have been very involved with the organization may be asking, where did those videos come from? You are the first ones to see those videos. They're hot off the presses. And did you like them? All right, questions? Yeah.
I got a question, just a moment. So we had a keynote speaker, speakers in person. I don't know if person is our friend or not, both, person and both. But when it's your keynote speaker for our organization, I never know whether to ask a hard-hitting question or a field question. What would be best for THCC?
Well, I invited the regional director of HHS to speak because we had been in a meeting and with one of his staff people who told us that Region 4, which covers Tennessee, HHS, had been told that Medicaid expansion was their #1 priority. And so, yes, there are friends, there are partners. We need to figure out how to pull them into the conversation. So they came and spoke. As far as hard questions, I'm not sure how to answer that, but. Tony.
Well, I'm an old dog who's been around this doghouse for a long time and sometimes get stuck in regards to where to go and how to get there. And I felt like this conference did offer some plans or offer some direction as far as where to go. And so I don't know if I have so much question as just more optimism. So I really appreciate the opportunity to be here today, listening to the speakers and getting a feel for where it's going. And I learned a lot, so that you can teach those dogs new tricks.
All right, thank you, Tony. We appreciate Tony's institutional memory. I can't tell you how often I'm emailing him. Do you remember back in the day? Who was that person? Yeah, but it is challenging. We're watching North Carolina, even Alabama apparently is moving forward with Medicaid expansion, and what's going on in Tennessee, and how do we re-energize that effort. So I'm glad you got some optimism. I did too, and we need to continue the conversation. I'm so grateful for the partners that have come today, and I think that that's got to be part of our conversation too, is to pull our partners together. Yeah.
Why don't you introduce Priscilla?
Oh, absolutely. I was going to say, you got to hear most of the staff, but Priscilla is our, as of a week ago, our insurance agent. She just passed the exam. And we are thrilled to have a bilingual component to our enrollment program now. This is all new within the last 6 months, but both Sylvia and Priscilla are completely bilingual, Spanish and English, and probably over a quarter of our people who enroll with us speak Spanish. So I'm just really grateful to have that capacity on their staff. I also didn't introduce Susan, who is, manning the registration table, but she's our office manager, and she's the one, talk about institutional memory. She's the one who knew how to put together a conference. So tell her thank you on the way out.
I just want to uplift the comment from the chat. So lots of great videos and thumbs up as well, but Marion Bacon says that she would like to start back with the Memphis group. And if someone could connect her with someone, she said, please tell Tony Garth that Marion Bacon.
All right. Thank you, Marion. We will definitely be getting back to you about Memphis. We need to be doing some enrollment work there in the very near future. So open enrollment starts in November. We've got some cute new business cards that you can hand out to all your friends and relations that need insurance. I hope you'll take some of those on your way out the door as well.
Can I say one more thing?
Absolutely.
I used to be on the board. I just want to say a huge thank you. Now not self-serving to Judy and to Rich, our chair, and to all the board members and the ex-board members in the center. It's a pretty crummy world out there sometimes, and you spend a day in this kind of setting, good ideas and honest expressions of problems and brainstorming, and congratulations to you too, Jack, on putting this together. It's sort of a fitting end to me, your story, Meryl. I just feel like it's so encouraging to spend the day, and I'm expressing my appreciation for all of you. This was a wonderful day.
Thank you, Barb. For those of you on the Zoom, Barb, as I said at the beginning, it's people like you who help people like me go on. Any other questions? All right, I am going to turn it over to Rich. We are going to collect your name tags and we're going to draw a couple out for the door prizes. So
I just wanted to say one more thing is that a lot of people, the enrollments are done over the phone, so we can do them anywhere in Tennessee. So there's no need to make an appointment to meet somebody. So.
all right, come on up, Rich Hennigan, board president of the Tennessee Healthcare Campaign.
I don't care what's on the screen, I don't think. Hello. Thank you for hanging around for the end of the conference. Thank you for coming to the conference, and thank to all who have signed up both online and here live. Barbara kind of stole my role here by thanking some people, but that's okay. We can thank them again. I want to especially thank Jacqueline Dalton over there, who was the conference planning chair, and also, as far as I can see today, the hardest worker running around keeping all of the IT going and keeping us all lined up in the right place. Thank you so much, Jacqueline, and thanks to the other members of the committee. I don't see Ann and Claire here anymore. There's Claire, okay. Oh, okay. And the other people on the committee as well. I want to also thank the staff for their participation today. And I want to thank the sponsors. I think the list of sponsors has been out and around. I'm not going to read them all off again, but they make these, y'all make this possible, but they make it possible to pay the bills for the conference. And so they are especially important. I just wanted to say a brief word about East Tennessee. There on the sponsorship list, there were two memorials, one to John Stewart and one to Dr. Freeman. John Stewart and his wife, John, they both passed away this past year. John and his wife were very great supporters of the healthcare campaign financially, gave their house over to house parties. John shared his inexhaustible talent and skill at advocacy and organizing for many years. And we will definitely miss him in our work. But it's good to see some younger people here who will also step up to take over some of those roles. And Dr. Dennis Freeman was one of the founders of Cherokee Health Systems and a longtime CEO, and he passed away a couple of months ago. And he was a key person in East Tennessee back in the early days of the ACA in working with the volunteers from this organization with his own staff in getting people enrolled across the state in those first few years. And he was also a big supporter of the healthcare campaign through the years. And I want to say also about your evaluations. It's not 100% clear to me. I meant to take this off. I've gotten to the point where I forget whether it's on or off. Your evaluations, I think here, there must be a box or a place to turn them in out at the front. So don't leave with your evaluation, turn it in. And the people online, okay, so there's a link in the chat to complete your evaluation, and I guess to send it on. Okay, so don't hang up your computer before you do that, because we really want to get some feedback about the program today. And then finally, I want to reinforce, we'd love to have a new crops of volunteers. So if you're not actively involved or deeply involved with THCC and you'd like to get more involved with our program and our advocacy, you can go online on our website. There's a button that you can click on and sign up as a volunteer, or you can send an email to Tom. It's tom@tnhealthcarecampaign, no spaces.org. So please join us. If you didn't see something up on the board there that you wanted to help us with, but you'd like to get involved, send us your name and tell us what you would like to be doing, and we'll see what we can do. So thanks again to everyone who made this possible, and have safe travels home.